Good afternoon, everyone. It's Rob here from Nutridyne Europe, back with Dr. Robert Silverman for our reorganized gut-brain webinar. I apologize for the last one, which had to be cancelled at short notice. A kind of imminent baby arrival kind of scuppered that one a little bit. But we're here now anyway, so looking forward to this one. As always, if people have any questions during the webinar, please stick them in the questions box, and I'll come back at the end and ask them to, well, pose your questions to Dr. Rob. So right, I'll pass it over to you, Rob, and take it away.
Fabulous. Thanks so much for having me on. Congratulations on the birth of your child. I'm sure things are pretty a little more settled down than they were that one day. And we're here with the idea of the superhighway to health, the gut to brain, gut optimization for whole body health. I don't know a sentence that really encompasses how I feel in ways that we should look at the body more so than really the gut is the epicenter of our health. It is the bullseye for our health, if you will. Even yesterday, I was trying to expand my knowledge to very detailed cholesterol markers. And in those cholesterol markers, we now have markers that will talk about producers, which obviously come from the liver. There's still a gut to liver bidirectionality, but cholesterol gets absorbed in the gut. So if our gut is not in working order, if you will, cholesterol is going to circulate and we're going to have high blood serum cholesterol. So even in that, it really resonated yesterday, something that I never thought would have a gut conversation has a imminent adjacentness to gut health. With all that being said, let's move on. Alessio Fasano said, just I think it was 2001, all disease begins in the leaky gut. About 2,000 years before, Hippocrates said all disease begins in the gut. So we went from the gut to the leaky gut, or what we like to refer to is increased intestinal permeability. So let's go through some gut factoids. Number one, 90% of scientific literature describing the microbiome was published in the last 5 years. So essentially everything we're talking about in the gut is new and it's coming at rapid fire pace. So you know, inside the gut, there's about 10 trillion bacteria cells, which outnumber our human cells 10 to 1. So we're truly 90% bacteria. Humans being 90% bacteria at a cellular level, most physicians unfortunately focus on the 10% and they ignore the 90% in our body. In doing so, they really look through a very narrow lens and become truly myopic when they don't look at the whole organism, which is bacteria. Genetics is 99% of our DNA, and that 99% of our DNA is bacterial. Now that 1% is really hard to change, but that doesn't mean that 1%, which is our genetics, has to be expressed, because genes load the gun, but they don't fire the gun. Lifestyle and environment does. Inflammation, as I've said before, or say probably on every presentation, my mantra is to manage and modulate inflammation. We never want it to go too high, and we don't want it to last too long. It is clearly the driver of chronic disease. Whether it's hidden or silent, those are true problems or causes of chronic diseases. One of the bigger problems of inflammation is adipocytes. They are our fat cells, clearly. They are depositories for toxins. So fat cells are depositories for toxins. They include inflammatory mediators like IL-6, IL-8, and VEGF. They are typically linked to a wide range of metabolic diseases, and all these inflammatory markers are associated with obesity. Bottom line is, they all have a negative effect on your gut. Therefore, if your gut is not healthy, you are not healthy. So what are triggers of gut permeability? Well, antibiotics, we kind of alluded to that before, where 90% of our body is bacteria. Imagine taking an antibiotic. One disclaimer, I am not anti-antibiotic. I just think sometimes they're used a little too prophylactically. If you look at the idea of gut permeability in reference to antibiotics, Obviously, if you take them, you have to realize that for 9 months after the consumption of 5 days of an antibiotic, you're going to have a 9-month period where you're going to have to use a probiotic and adhere to some gut reflourishing protocols. Acid blocking drugs, PPIs, they are one of the most damaging things to one's overall health. And I think the biggest issue with the acid blocking drugs is, one, people have the opportunity to get them over the counter. And number two, more so than that, they also damage the gut. And number three, they're allowed to take them for long periods of time because they are over the counter. And typically you take acid blocking drugs for 4 to 6 weeks at maximum. NSAIDs, non-steroidal anti-inflammatories, do decrease pain, but they impair healing. Nutraceuticals decrease pain, but promote healing. Which do you prefer? NSAIDs, again, are damaging in that they damage the gut and they also damage the blood-brain barrier. Heavy metal exposure will lead you down to a compromised gut permeability. Environmental toxins are very damaging. Concussion, 60% of people who have a concussion have either leaky gut or SIBO, small intestinal bacteria overgrowth. Cesarean birth leads to gut permeability. Liver toxicity, which we touched upon before, the chemicals from the gut and the liver are intertwined. Gut dysbiosis, the unleveling of good and bad bacteria. We need about 85.1% good bacteria to avoid gut dysbiosis. Food sensitivities. Food sensitivities for me are one of the hidden issues in the gut. Food sensitivities are a problem because 72 hours after ingestion, you will see the symptomology. So therefore, no doctor, no patient's really going to understand a food sensitivity. They'll understand a food allergy, which is much quicker in symptomology, typically within an hour after ingestion. Yeast and bacteria overgrowth. We've got bacteria overgrowth, small intestinal bacteria overgrowth. Yeast posing a problem with candida. You can have a sensitivity to an overgrowth leading you to gut permeability. Chronic stress, whether it's stress, physical or emotional. Sleep deprivation doesn't allow your gut to heal from its daily damage. Chronic inflammation poses a problem. It burns a hole in your gut, if you will. Alcohol, gluten, and dairy foods really all should be avoided and minimized. Sugar, especially added sugar and or fructose, the sneaky carbohydrate, will all damage and lead to increased intestinal permeability. Artificial sweeteners, your equal, your aspartame, are major problems in that they also lead to gut issues. They also increase the incidence of stroke and dementia by 2 to 3 times. And last, one of the hidden issues everybody should test for, food additives and emulsifiers. People have seen this before. There's always some new things with my Dr. Rob's Gut Matrix. Kind of talked about the gut already. When you talk about the gut, we talk about the small and the large intestine. Most of the issues that we have when it comes, or I should say, with leaky gut, you're talking about the small intestine. It becomes too permeable. Too permeable in that things that are not supposed to pass the gut pass the gut. My new metaphor is that the gut is like a screen door in the summer. The screen door lets, if it's in good condition, lets what's supposed to go through it like air. If there's a hole in the screen door, obviously insects and other items can pass because it's too permeable. Same holds true for your small intestine. Your small intestine is supposed to, in its pristine condition, allow small digestible food particles, vitamins, minerals, and water get through. If it's too permeable, bacteria, viruses, and large undigestible food particles go through. Those large undigestible food particles lead you down a deleterious path towards damage in the body via localized inflammation, systemic inflammation, ultimately leading to the high-level molecular mimicry and cross-reactive foods, etc. Now, one of the bigger problems there is the food sensitivities. We touched on that before. This is not a food sensitivity webinar. I do hope that in the next few months, we'll be able to come back and do a food sensitivity webinar and show you some tests to help you in your office so you're able to magnify the issue that patients have, and then you'll be able to elucidate what they need to do. That leaky gut can come, as we talked about, yeast and fungus overgrowth, dysbiosis, and the release of something called LPS, lipopolysaccharide, holding gram-negative bacteria on the inside of the intestinal wall. When LPS gets through the gut and into the bloodstream, LPS is what we call an endotoxin. That LPS as an endotoxin can damage different organs. As an FYI, LPS expression leads the male body to a decrease in testosterone and the female body to a decrease in estrogen. In addition to that, the expression of LPS increases the incidence of heart disease by 3 times. All that being said, the bidirectionality between the liver and the gut, toxin and chemical overloads, liver dysfunction from the gut, higher incidence of insulin, blood sugar issues, and prediabetes if you have a leaky gut. Usually leaky gut is a direct correlation to obesity. Leaky gut, as we said before, has an increase in autoimmunity, therefore your thyroid. And for all you chiropractors, naturopaths, and such, a leaky gut leads to the release of cytokines and MMPSs. Cytokines are inflammatory markers leading to arthritis and joint pain. MMPSs are your matrix metalloproteinases. They are released at the time of injury, and they lead to damage in soft tissue injury and fibrocartilage. And lastly, one of the big highways, if you will, or bidirectionality, I call it the superhighway to health, the gut to brain, brain to gut axis. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. So I know we have a question already. First probiotic choice after antibiotic cycle. My man, Diego, we love you. I'm going to answer that and write all your questions down, and I'm going to stay on and answer them all. First probiotic after antibiotic. Here's my antibiotic protocol for probiotics. Saccharomyces boulardii, because it's a yeast, and the highest level, Rob will have to text it to you because the name is escaping me. Rob, if you would, and you can even say it on the webinar, whichever probiotic has the most colony-forming units, you want to blast it. So you would mix those two. You would take the Saccharomyces boulardii throughout the day. You won't be killed by the antibiotic. And that colony-forming unit is something like a spectrum or something of that nature. You would take before you go to sleep because you won't take your antibiotic before you go to sleep. So here's a PowerPoint presentation that really depicts a healthy, pristine, leaky gut. There's healthy cell junctions, there's healthy villi, good absorption. So you've got these small digestible food particles that are depicted by the white balls. You've got these blue, large, undigestible food particles. When the gut is in tow, if you will, you'll see that the large undigestible food particles get sent to the large intestine to be eliminated, whereas the small digestible food particles are going through the small intestine to provide nutrition to the body. Conversely, you have damaged cell junctions and damaged villi and poor absorption. You'll see both small and large digestible food particles get through. Those blue balls will be recognized by the immune system. They will hence be attacked, and you will start that inflammatory to autoimmune cascade. So GI health is a critical component in the inflammation cascade. 60–80% of immune cells are found in your GI tract. Lymph nodes in the GI allow immune cells triggered in the GI to circulate through the body. The last theme is transmigration of antigens across the GI barrier may trigger a systemic immune response. Immune cells activate an inflammatory response. Let's look at this bidirectionality. So immune cells identify an antigen. Cytokines are produced, interleukin-1, interleukin-6, and tumor necrosis factor alpha. These cytokines actually recruit more immune cells. Therefore, the more cytokines produced, the more inflammation. So essentially, once you get inflammation, if it's not modified and managed, the inflammation will increase or stay for a long period of time, both very ruinous to overall health. As Alessio Fasano once said, the gut is not Vegas. What happens in the gut doesn't stay in the gut. Lipopolysaccharide-induced mitochondrial DNA can contribute to NLRP3 inflammasome. So let's take a look. The LPS attaches to toll-like receptor 4. There's 2 ways to stop that LPS. 1, keep your gut in pristine condition. 2, that LPS will not cling or attach to toll-like receptor 4, and that can be stopped by omega-3 fatty acids. So you have your marching orders. Use my 7R program, have a good program, and within it, using omega-3 fatty acids. Therefore, if LPS stimulates toll-like receptor, NF-kappa B inflammatory pathway gets stimulated via 2 signals. They also cascade to the release or the upregulation of NLRP3 inflammasome, which then releases interleukin-1 beta and cytokines. It's a dual signal. Signal number 1 needs to be blunted by omega-3 fatty acids. Signal number 2 on the right side needs to be blunted by ketone bodies. The gut to brain connection. Let's get to the root cause of the broken brain. So the gut to brain, let's use this in a factoid manner. Number 1, 400 times the amount of messages from the gut to the brain than the brain to the rest of the body. Over 1,000 species. There's 3 pounds of bacteria in your gut, real small amount, but yet there's trillions of bacteria and bacterial species in your gut. There's 20 million bacterial genes versus 2,000 genes in humans. As we know, there's more bacteria than cells in your body. The gut contains more neurotransmitters than the brain. 93% of serotonin is in the gut. Gut to brain, number 1, produces vitamins, digests foods, regulates hormones, excretes toxins, and produces healing compounds. Therefore, if you're going to treat the brain, without question, if you're somebody who's a brain-based practitioner, you must also remove some inflammation or a cause of inflammation from the body, and you may look to refer to the concept of leaky gut. So real basic here, gut on fire means brain on fire. Brain on fire means gut on fire. When the gut is on fire and the brain is on fire, there are no symptoms of pain since the brain has no pain receptors and the inner lining of the GR mucosal has no pain fibers. When the gut and brain are on fire or inflamed, the typical symptoms are bloating, followed immediately by brain fog. Inflammation of the brain's neurons in the brain does not cause pain, instead reduces nerve conduction. This reduced nerve conduction results in slow nerve transmission that is typically described as brain fog. Here's a beautiful slide that really depicts the idea of a gut in a functioning order on the left, and on the right, a leaky gut. That leaky gut on the right has toxins that get through the tight junctions. They burrow their way through the mucosal membrane cells. They get into the bloodstream. IgG, IgM, and IgA are reacted from B and T cells being released, leading you down a path of these results. Number 1, nutritional malabsorption. Number 2, autoimmunity. Number 3, food sensitivities. Number 4, blood-brain barrier breach. And number 5, systemic inflammation. We can look at it another way where environmental triggers lead to breakdown in oral tolerance, leading to a change in the gut microbiota. Enhanced gut permeability to large macromolecules are now present, leading to immune reactivity, autoimmunity, and neuroautoimmunity. This is a 6-step mechanism demonstrating the induction of autoimmunity and neuroautoimmunity by environmental triggers. Oral tolerance is classically defined by the suppression of immune responses to antigens that have been administered previously by the oral route. Here we have a great slide depicting the idea of gut having a major impact on neurodegenerative disease. This one being Alzheimer's disease. So therefore, LPS is abundant in Alzheimer's disease. It affects the brain neocortex and the hippocampus. LPS activates toll-like receptor both 2 and 4. This leads to cytokine production, inflammation, and innate immune defense responses that produce central nervous system pathology. The microbiome-derived neurotoxins play a strong role in shaping the human system and contributing to neurodegeneration. Bottom line, LPS allows and can carry amyloids from the gut through the blood-brain barrier into the brain. So when you see these new drugs attacking amyloid, they are attacking the end result. They are not helping what we call root cause resolution. The gut and the brain Bidirectionality, Parkinson's is a great example. Just let's remember one major point. The gut epithelium is a multifunctional interface. The bidirectional interplay between the brain and the gut is mediated by one thing, or one of the major things, which would be the vagus nerve. So we'll break that down a little bit more. We've got a lot to cover. Let's keep going. ALS. Gut microbiome has alterations in people who have ALS. Unfortunately for me, what I've seen, the ALS of the neurodegenerative diseases is the fastest disease down the health slope. The gut microbiota composition changes during the course of ALS. 6-month probiotic treatment influenced the gut microbial composition. The role of the gut microbiome in autism. The gut microbiome is associated with autism. The gut alters immune system and metabolism. Higher intestinal permeability with higher antigenic load from gastrointestinal areas. LPS is increased in autism. There's less diversity in those who have autism. Candida is twice as abundant in autism, and up to 90% of people with autism suffer from gut problems. So the role of the brain-gut microbiota axis in the body. The major pathways of the brain-gut microbiota are clearly shown in the central nervous system, the periphery, and the gut. The network of neural signals, immune cells, and chemical signals constitutes a major part of the brain-gut microbiota axis. Alterations in this network involve complex interactions across organs by direct nerves and indirect systemic circulation pathways, contributing to altered homeostasis in the body. Changes in the gut microbiota composition and microbiome-derived short-chain fatty acids can alter neural signals, immune signals, and chemical signals to cause depression. The central nervous system works through neuroregulation, neurotransmitters, immune signals, and other factors that target peripheral organs and tissues in response to different signal reflexes, thereby controlling the normal bidirectional brain-to-gut axis signaling. When this balance is destroyed by stress, depression, or other diseases may occur. So as we take one more little look at the role of the brain-gut microbiome in depression, an unhealthy lifestyle is due to increased sustained stress, infection, or other factors that can cause dysbiosis of the gut microbiota. Abnormal conditions in the body may be bidirectionally regulated by the brain-gut microbiome via, again, neural signals, immune signals, or chemical signals, thereby contributing to depression. So this is a great slide really to spend time. I can send the deck if somebody needs it, but this is a great slide. Take a look at it, and I know Rob will be sending a copy of the recording. Spend a little time on this one. So here's a 6-month follow-up of the gut microbiota in patients with COVID-19. The study found the microbiota richness was not restored to normal levels 6 months after recovery. So bottom line is, if you had COVID or your patients have COVID, start looking at the gut. Patients with lower post-convalescent richness showed a higher level of C-reactive protein and illness severity during acute phase of COVID-19. Persistent reduction of the gut microbiota richness may have long-term biological influence during COVID-19 pandemic. The results, follow-up studies 3 to 6 months later, patients with lower microbial richness had worse pulmonary functions. The takeaway is your gut's damaged from COVID-19. Really test it and try to work with these patients, part of your long COVID protocol. So the COVID's impact on the GI was very obvious, and that it was a loss of diversity, loss of beneficial bacteria, expansion of pro-inflammatory bacteria, expansion of yeast, increased incidence of leaky gut. The leaky gut COVID connection was linked to an increased incidence of heart disease. Interesting in that severe COVID-19 complications will link to gut barrier breakdown, in that there's a disruption of the gut microbiome lung interactions. There's a gut to lung axis. In the original COVID, or the wild strain, as they said, the gut microbiota affects the lower levels of the lung. Lung damage interrupts crosstalk between lung cells and gut microbiome. This all triggers a systemic inflammation, causes gut barrier breakdown, causes microbes across the gut to enter the circulation and worsen lung injury. This completes a positive feedback loop. Again, if you have any questions, write them up. I'm going to answer and tackle every one of them. I have no problem. We had a great question from Diego before in that we asked about, and I get that asked a lot, what about post antibiotic treatment and which probiotics? And that was a great one. That was a good protocol to share with everybody. Continuing with the concept of severe COVID-19 complications linked to the gut barrier breakdown, inflammation promotes excessive gut permeability. Tight junctions become more permeable with COVID-19. There's an increase in zonulin. Zonulin is a protein enzyme that expresses a diametric pull at the tight junction region. So an increased zonulin is a marker for higher mortality in severe COVID-19. Lipopolysaccharide is increased with severe COVID. Occludin, which is the structures or the protein structures that hold the tight junction together, are also elevated. So continuing with that concept, microbial translocation is associated with systemic inflammation, getting increased neutrophil and monocyte markers in severe disease. Interleukin-6, interleukin-1 beta, C-reactive protein, and D-dimer are all elevated. The gut permeability modulates metabolite levels in severe COVID. Abnormalities in glycation cause dysregulation of inflammation. SARS-CoV-2 and LPS. I'm a big proponent. I would do a whole webinar just on LPS. Look at these factoids. LPS leads to an overactivation of immune response during SARS-CoV-2 infection. LPS is recognized by toll-like receptor 4, which is part of your innate immunity. It binds to two different proteins, both of which in SARS-CoV-2 are S1 and S2. LPS binds tighter to S1. That toll-like receptor cascade is boosted from S1, and NF-kappa B, shouldn't be 6, NF-kappa B is boosted by S2. The conclusion was the S protein acts as a delivery system, taking LPS into host innate immune pathways. LPS, when it attaches to organs, leads you down a path of an injury. Gut health compromise in severe COVID-19. So we're getting close to the halfway mark. So here's a picture depicting the microanatomical features identified in allele post-mortem samples from patients who died from COVID-19. So essentially, you're seeing those who died had a major issue in the microbiome itself. Let's take a look at and take it to the next step. Let's look at the SARS-CoV-2 in the GI tract. The epithelium, number 1, expresses zonulin. In numeral 2, there's a failure of the tight junctions leads to increased intestinal permeability. And number 3, SARS-CoV-2 in systemic circulation leading to hyperinflammation. Bottom line is that SARS-CoV-2 damages the tight junction. The virus, which gets shedded in the gut, now doesn't get through the gut. It gets through the tight junction and gets back into the bloodstream to have a hyperinflammatory response. Jumping on that concept, you may have leaky gut and not be able to shed properly to start with the virus. Either way, it's our fort, it's our closed defense mechanism. So before I jump into the gut to lung connection, got a little question. Is zonulin expressed in the blood-brain barrier as it is in the gut? It is. Zonulin is also expressed, but there's different, I'm looking for the right word, there's different stimuli, and there's a different control to measure between the two. So the gut-lung connection, let's dig into that a little bit. So number 1, this is a model for COVID-19 pathogenesis leading to extrapulmonary complication. Localized infections by SARS-CoV-2 mostly begin in the respiratory system and then progress to the GI tract. They may later develop in a systemic disease, resulting in a multi-organ complication. Disrupted gut barrier integrity is associated with elderliness or underlying chronic conditions such as hypertension, diabetes, and obesity, which may be a crucial effector that allows the virus to gain access to the ACE2 on the enterocytes and leak out of the GI tract to spread throughout the body. If SARS-CoV-2 penetrates the gut barrier, It may cause inflammation due to overly reactive immune responses that thereby further increase its leakage from the gut. Contrastingly, in a healthy GI with higher number of Treg cells, due to their activation by butyrate, the king of the short-chain fatty acids, the virus may be contained in the GI tract and excreted in the fecal matter without posing a considerable threat to the other organs of the body. So the gut-lung communication has 6 ways. So gut to lung can communicate via environmental products, bacteria, bacterial fragments, short-chain fatty acids, immune cells, and signals via largest cranial nerve in the body, the vagus nerve, through afferent intervention. So the gut-lung axis, gut disorders can affect lungs and lung diseases can affect the gut because both share similar immune messengers and inflammatory process. So again, gut to lung and lung to gut bidirectionality, especially the lower lung. I put this particular slide in, and the reason I did was the gut to lung axis is damaged via the association of dysbiosis. So you have a viral lung infection, which alters the microbiota, therefore leading to increased gut permeability, leading to increased inflammation like a cytokine storm, looking for translocation of bacteria, fungi, toxins, and inflammatory products to the circulatory systems, all leading to a damaging effect throughout the body in structure, nerve impulses, and circulatory system. So pulmonary epithelium permeability, leaky gut, leaky lung. There are healthy barrier systems. Number 1, there should be gut. Number 2, there should be the blood-brain barrier. Number 3 is the nose, upper respiratory. We've got the lung, and we've also got gut to skin. So piggybacking on that idea on pulmonary epithelium permeability, number 1, the leaky lungs. Lungs actually have tight junctions. They're claudin proteins that actually keep the pulmonary barrier intact. These claudin proteins are sensitive to chemical irritants or pro-oxidants. They have chronic inflammation, which can break down a barrier, and L-glutathione is critical to protect against lung damage. So you guys seen my Super 7 action plan. I'd rather ask questions at the end, but I'll give you a brief overview. Number 1, you want to reset your diet. You want to reset your lifestyle and your mindset. Mediterranean diet, ketogenic diet, a low carbohydrate diet are all great choices. Get that lifestyle change, incorporate diet, incorporate exercise, flexibility, meditation, change their mindset. You know, I don't know about where you guys are in the UK, but I think it's very similar. Americans are depressed. They feel like they've lost over 2 years of their life. Well, we are here now, and we have to do what we have to do to go forward. So remove what? Well, you would remove unwanted pathogens, pathogens like viruses, pathogens like bacteria, fungi, pathogens through detoxification in reference to toxins. This is also where you do your food sensitivity test. And in your food sensitivity tests, we would really speak to the idea of taking those foods out. And lastly, something new that I'll be discussing in future presentations, removing and breaking apart the biofilms. Number 3, replace needed digestive enzymes and stomach acid. Stomach acids, digestive enzymes, pancreatic enzymes, and increasing bile flow. Regenerate. Regenerate what? The damaged intestinal mucosal. So you want to heal and seal the gut lining and create an anti-environment in the gut. Number 5, reinoculate with quality pre and probiotics. It has been stipulated now that we think that the prebiotics may be more important than the probiotics. Number 6, reintroduce. This is where you will retest for your food sensitivities and or do a reintroduction of foods that were removed in step 2. Each food, if you don't retest, will take 3 days. And 7, retain your health and GI integrity. So let's go through the particular products. There's a lot of products here to discuss. I'm getting all my little sheets. I wanted to talk about some case studies if that was possible at the end of the day. Nevertheless, let's look at my Super 7R action plan. I'm going to highlight one product in each. So it's Esperlardi, MCT oil, and magnesium citrate. Remember, MCT oil is absorbed directly into the portal vein and then travel directly to the liver. Because MCTs are not stored as fat, the energy they produce may be immediately by organs and muscles. So the one I wanted to talk about is Asperlardi. Nutridyne's Asperlardi is a probiotic made with a gut-supporting and heavily researched yeast strain known as Asperlardi. Contemporary clinical research demonstrates the proclivity of probiotics in healthy gut flora to support a healthy human GI tract. Moreover, research reveals that probiotics can support the immune system, promote healthy hormone functions, and even support healthy body mass. Nutridyne's Asperlardi is a dairy-free, gluten-free, non-GMO, vegetarian-friendly, and is manufactured with 5 billion viable cells. So the remove phase. In the remove phase, we would use Spectrum AR for airway, Spectrum BR for the bowel, berberine, great multifaceted berberine. You use berberine for a lot of blood sugar, cholesterol, gut, etc. Garlic Pro is also an excellent choice. There's where you would fit in your detox phase 1 and 2. Now, I don't know if Rob has any activated charcoal yet. If not, I'm pretty sure that he'll be getting some, and that would go into a succeeding webinar on biofilms. And maybe the big boy, GI Defend, which I call the mop of the gut. If you had to take one thing, I'm using GI Defend, because GI Defend helps support a healthy mucosal immune system and digestive function. Some of the key dynamic GI Defend benefits include promoting health gut homeostasis, supporting healthy gut barrier function, supporting healthy digestive function, promoting healthy immune function, supporting respiratory health, promoting healthy nutrient absorption, supporting healthy muscle protein synthesis. Rob, would you do me a favor? I know you can hear me. You don't have to respond. Could we also, either in the chat or in the follow-up email, send something out on GI Defend, because people ask a lot of questions to me about that.
Yeah, sure, no problem.
That is a winner. It's the mop of the gut. Third one to replace. Here's one of your most versatile products you can have, in that it's the Digestive Complete. So essentially, it's the only one I use in the replace phase because it has needed stomach acids, pancreatic enzymes, and it also increases bile flow, which is a critical gem to overall outpatient optimization outcomes. So regenerate. So you're going to have your dynamic GI integrity and GI restore. Let's look at GI integrity. That one I'm going to star. Dynamic GI integrity is a comprehensive nutritional formula designed to support optimum GI health and function. The lining of the gut must have proper permeability and integrity so it can not only absorb nutrients, but also become a gatekeeper and promote healthy nutrition exchange with the bloodstream. As such, it maintains gut health, therefore being the key to maintaining overall wellness. Some of the benefits of GI integrity are GI tract integrity and function, support for healthy digestive function, support for nutrient absorption, promotes waste removal. It's got 78 milligrams of zinc carnosine, and of course it hits the button on naturally flavored, gluten-free, dairy-free, vegan, no GMOs, preservatives, or added sugar. Pro-resolving mediators, one quick little mention of PRMs. Pro-resolving mediators allow for the resolution of inflammation. If my mantra is to manage and modulate inflammation, the resolution of inflammation is a great choice. Omega Pure Complete, that's your fish oil, but that's your fish oil with pro-resolving mediators, vitamin A, vitamin D, and a great antioxidant in astaxanthin. Alpha lipoic acid, the only antioxidant that works with the water in the fat part of the cell, is included in the regeneration phase. And everybody knows D3 with K2's potent powers. Reinoculate. Reinoculating of the gut, spore probiome. Let me highlight that. That's a simple thing in that it has a spore. A spore, again, Diego, will not be damaged by a probiotic because it's encapsulated. It's sort of like an acorn, if you will. It's the nut. It has a nut around, it has a covering around the nut to be protected. So the spore comes with a leading edge prebiotic called XOS, xylo-oligosaccharides. It also comes with a bacteriophage, and that bacteriophage is great at antibiotic resistant bacteria, great again for biofilms. And ultrabiotic daily multi-strain is the multi-strain that we would recommend for people to take on a daily basis. If you're going to reintroduce certain foods, these are things that I would recommend, certainly in America, to avoid. GPS, no gluten, no processed food, no sugar. DNA, no dairy, no nicotine, no artificial sweeteners. Fried foods, and any food still you may be allergic or sensitive to. Retain, you want to retain your health, your Super 5, your diet, your lifestyle, your mindset. Dynamic GI Restore. Take your pick between Spore, Probio, and Ultrabiotic Daily Multistrain. Fruits and greens with immune support. Patients love it. Mix it in any one of your medical foods. I take this every day. I take that, fruits and greens, with the next thing, Dynamic Multi Collagen Renew, and a little hydrate. And I've got a great shake during the day as a snack or as a meal. Now, I had mentioned the Dynamic Multi Collagen Renew, which is unflavored blend of collagen peptides to support healthy skin, bones, and joints. This concentrated dietary source of collagen is an excellent choice to support high protein intake with a host of health benefits, promoting healthy skin, healthy nails, healthy joints, healthy bones, and healthy ligaments and tendons. That is a staple on things that you could use. So the most effective clinical outcomes across all disease spectrums can result from the normalization of gut function. We've got about 20 minutes. I'm going to pick the pace up. Bottom line in this slide, we could spend 20 to 30 minutes just on this slide. This slide really speaks to the idea of 3 potential mechanisms by which the gut microbiota can induce intervertebral disc and cause low back pain. Number 1, the translocation of bacteria across the gut epithelial into the IVD, regulation of the mucosal and systemic immune system, and regulation of nutrient absorption and metabolites formation at the gut epithelium and its diffusion into the IVD. And this breaks it down a little bit more. Again, you've got bacterial infiltration, injury-induced inflammation, and metabolites and cytokines. So the bottom line is we now have something new to talk about in the gut to the gut to disc axis. But the spine, the role of the gut in the microbes in the pathogenesis of spondyloarthritis. Intestinal microbiota is firmly implicated not only in the pathogenesis of the inflammatory bowel disease, but increasingly also in the development of inflammation at extraintestinal tissue sites. So it's not just at the disc, it's in the spinal joints. Here are some interesting takeaways. Number 1, half of the people with spondyloarthritis exhibit signs of microscopic gut inflammation. Chronic gut inflammation predicts higher risk of evolving to ankylosing spondylitis or arthritis in the spine. The remission of joint disease is associated with reduced bowel inflammation and vice versa. Therapies targeting the inflammation of both sides may be beneficial in spondyloarthritic patients with bowel inflammation. So here's your protocol. Bottom line, EPA DHA in a virtual 2-to-1 ratio. 4 to 6 grams are needed of omega-3 fatty acids. That will dramatically decrease your arachidonic acid to EPA ratios from 40 to 20. That's in 1 month period of time. The conclusion was as such: omega-3 fatty acids dietary supplementation reduces systemic inflammation by lowering arachidonic acid and EPA ratios. This supplementation has a potential protective effect on the progression of spinal disc degeneration. Vitamin D, 5 to 10,000 IUs of vitamin D with K2. Subjects with vitamin D deficiency or insufficiency were 2.3 times more likely to exhibit lower back pain than subjects with normal vitamin D concentration. Vitamin D for disc degeneration. You'll see an increased risk factor for disc degeneration with those who have blood sugar problems. Diabetes or prediabetes damages small blood vessels. They all adversely affect discs with poor nutrient supply. Therefore, vitamin D reduces inflammation and improves markers of insulin resistance. I don't call it vitamin D in my office. I call it hormone D. It just does so many different things. Interestingly enough, in the spine, glucosamine and chondroitin have shown to support overall musculoskeletal integrity. In that integrity, what's most interesting, this was a 2003 study. That study, MRI was used, which is highly objective, and it showed that long-term glucosamine and chondroitin may counteract symptomatic spinal disc degeneration. Glucosamine is the gag, so it's the structure in the spine. Chondroitin is the water that sucks it back in. So therefore, you have a post-injury improvement through the utilization of glucosamine and chondroitin. The gut to joint axis. Now, we could spend a ton of time on this. Basically, in chiropractic care, we see many patients with joint disorders. What we're not realizing is the root cause of could be the gut adversely affecting the joint. We'll put it in a very tight bow. So let's take a look at this particular PowerPoint. Digestion and barrier integrity problems lead to the release of toxins. GI inflammation and leaky gut initiate a cascade of signaling events that increase inflammation. Antigens and these toxins adversely affecting the bidirectionality of the liver. When the liver is activated, comfort cell activation leads to localized inflammation and ultimately systemic inflammation. Or leaky gut may lead to autoimmune conditions. Through the gut, the leaky gut, an antigen gets through. There's a transmigration of antigen through the leaky gut. That antigen can be depicted by a bacteria, virus, a microbe, and most commonly a protein. Th dominant enhance immune reactivity. B and T cells are stimulated. B cells form antibodies. They attack the antigen. You have an antigen antibody effect. Antibodies confuse themselves with cartilage, with the antigen. Now you're getting molecular mimicry. And at that knee synovial joint, there's immune reaction against the joint, resulting in pain, swelling, and tissue damage. If it's at the synovial part, it's rheumatoid arthritis. If it's at the osseous part, it's osteoarthritis. LPS, the release of LPS leads you down a path of causing muscle pain. There's a direct link between gut bacteria, successful joint replacement. Healthy gut flora could lower the risk of infection following knee and hip replacement surgeries. Unhealthy intestinal flora may increase the risk of infection. Here we're looking at something so small as bacteria, unfortunately, can have these far-reaching effects. When intestinal microbiome is altered, cytotoxins from gram-negative bacteria are released. These cytotoxins assist the bacteria in the invasion of epithelial cells, where they attack the cell's DNA. This causes a breakdown in the intestinal barrier, releasing bacterial cytokines and other immunogens into the bloodstream. The systemic inflammation due to these immunogens may play a role in autoimmune reactivity in the body. So the takeaway here is very simply, intestinal permeability leading to environmental triggers, leading to systemic inflammation, leads to joint tissue reactivity. So here's my joint protocol. Chondral joint aid. Let's stop right there. That is a leading edge protocol. It's a unique and powerful combination of nutrients. It actually has chondral relief intensive care, and Herbalese all together. These all support cartilage and soft tissue, along with the herbal support for joint and muscle discomfort. In it, you're going to see glucosamine HCl, chondroitin, vitamin C, manganese, MSM, and some of the things we're going to talk about, which are green lip mussels, hyaluronic acid. Excuse me. So for the additional ingredients, etriol is a proprietary extract of New Zealand green lip mussels that contains the essential fatty acids and ETAs. It plays a critical role in the reduction of joint swelling due to arthritis. Studies show that ETA oils from sea mussels are more effective in reducing inflammation than aspirin or ibuprofen. Hyaluronic acid, a key natural component of all connective tissue in the body. Production of hyaluronic acid declines with age, and this deficiency causes numerous age-associated problems. Hyaluronic acid supports resilience, reduces friction, and acts as a natural shock absorber. Hyaluronic acid found in concentrations in cartilage and synovial fluid in all joints help regulate the repair processes during injury, inflammation, and surgery. ASU, which is shown to help with cartilage cultures, and it also has nettle leaf, an anti-inflammatory remedy suppressing cytokine production, and has been shown to suppress common NF-kappa B inflammatory signals. So this is a winning product without question. Then we add joinees, and it says what it does. And again, if you have any questions, feel free to reach out to Rob. He will share any of the detail sheets. Saccharomyces boulardii, we highlighted before. Bone strength, extra strength, that's a great thing for any women who need some help in bone strength. And we've kind of talked about the collagen renew. Are all joints, here's another question. Hey, Diego, what's up? Are all joints of the body affected the same way, bacteria infiltration, or is there a preference for the biggest joints and why? You know, they did not signify whether it was a large joint or a small joint. I personally think the smaller joints are more susceptible because there's less surface area, but the immense takeaway is these joints are getting hit. They're in the periphery and they're in the spine. They're even at the disc level. They're in the shoulder level. And if you're a functional medicine person who does musculoskeletal, this is the jam. Alrighty. So here's your low back protocol. Of course, always consider your Super 7R action pan simultaneously with Omega Pure EPA DHA 2400, 2 tablespoons daily. D3 5000 with K2, 1 soft gel daily. Chondral joint aid, 1 pack twice a day. Optional pro-resolving mediators, resolution of inflammation, 2 soft gels BID. And as we got about 10 minutes left. Let's really dig into the brain. So how does COVID affect the brain? Well, we know that COVID-19 is such a small virus, it actually can slip past the blood-brain barrier. One of the keys here is the spike protein is a virus to infect the cells and is strongly able to bind to ACE2 receptors, as it's been reported in multiple news reports and in many different articles. In fact, the spike structure and function is known to have highly important implications for cell infection as well as for entering the brain. Growing evidence indicates that different types of coronavirus not only affect the respiratory system, but may affect the central nervous system. So let's remember that neurological symptoms when the virus passes the blood-brain barrier are on the list right there of headache, impaired consciousness, epilepsy, acute cerebral vascular disease, stroke, and endotheliopathy. So some of the mechanisms of the blood-brain barrier disruption induced by peripheral inflammation, interestingly enough, it's damaging again that blood-brain barrier. Number one, the first one, there are changes in tight junctions. 2, there's damage to endothelial cells. 3, there's activation of astrocytes and microglial. 4, there's alteration of multiple transport pathways and receptors. And 5, there's penetration of the peripheral immune system. So COVID-19 has a direct correlation to brain shrinkage, most commonly linked to areas of the smell. In a study with MRIs, 785 people before the pandemic, averaged 38 months later after those original MRIs, 401 patients, more than half, were tested positive for COVID-19. There was a reduction in the gray matter. With that gray matter being damaged, your brain is going to be out of order. So here's another protocol. I'm going to share a protocol repairing the blood-brain barrier. I've looked for others, and I can tell you that at this juncture, I think this may be one of the only protocols to repair the blood-brain barrier. Number 1, avoid gluten. 2, fix the gut with my 7R action plan. Probiotics, but we're going to switch the strain and species to Lactobacillus paracesi, Acidophilus, and Bifidobacterium lactis. The Acidophilus and the lactis more common. You may want to do a heavy metal detox. Acetyl-L-carnitine is a great choice. It protects the mitochondria in the cells. Alpha-lipoic acid preserves the blood-brain barrier integrity by reducing oxidative stress. Activates the NRF2 while inhibiting the NF-kappa B pathway. Berberine blocks activity of matrix metalloproteinases, reducing inflammation and brain injuries. Curcumin is also a great choice because it increases concentration of tight junction protein in brain cells. D3 protects blood-brain barrier by increasing the level of the blood-brain barrier proteins called Claudin, ZOL1, and blocking MMP9. MMP9, matrix metalloproteinase 9, is the one matrix metalloproteinase that eats up the blood-brain barrier. Sulforaphane. Sulforaphane, if you want to have it from food, from cruciferous vegetables, you need to chop it or chew the vegetables. If you cook it, you lose myronase and lose about 60% of the sulforaphane. So a supplement of sulforaphane prevents breakdown, permeability, inhibiting MMP9 and activating the NRF2 anti-inflammatory pathway through phase 2 of the detoxification. Omega-3 fatty acids increases cell membrane fluidity, strengthens blood-brain barrier, and blocks matrix metalloproteinase 9. Resveratrol reduces inflammation and restores the integrity of the blood-brain barrier. Pro-resolving mediation leads to reduction of cytokines, chemokines, and different MMPs. Some lifestyle hacks. Sleep. Sleep restricts impairment function of the blood-brain barrier, increasing permeability. Melatonin stabilizes the blood-brain barrier, preventing damage caused by TBI. I am a huge melatonin fan. I know melatonin is a problem in the UK. Just want to throw it out. When you guys are able to get it, you guys should definitely try and utilize it. You want to avoid environmental molds and microtoxins. Microtoxins reduce the integrity of the blood-brain barrier, cause neurological damage, increase permeability of blood-brain barrier, and of course, B vitamins are a great choice. So let me give you some of the highlights through Rob's Nutridyne protocol list. Here's your blood-brain barrier protocol. Dynamic multi-power is 1 scoop daily. Great choice for a multivitamin, multimineral. Dynamic brain restorer, let's highlight that. Research cited that the nutrients contained in a dynamic brain restore powder may support cerebral and nervous system function in a variety of ways. Moreover, the nutrients work in concert for proper DNA maintenance, energy production, amino acid metabolism, and a variety of other processes. Here are some of the major features. Brain restore powder, or dynamic brain restore powder, supports cognitive function and healthy mood, supports and maintains DNA, supports blood and oxygen flow to the brain, supports neurotransmitter production in neural tissue, helps metabolize amino acids. So when you take a good look at what it has, you're really looking at a full litany, or if you will, a surfeit amount of nutrients that are needed. You have acetyl L-carnitine. You've got all your vitamins that are needed. You have your alpha GPC. You have your UMP. You have alpha GPC. So these are critical nutrients that are pointed at overall healing for the blood-brain barrier. You can up your dosage of vitamin D. D3 will be at 10,000, of course, with K2. Pro-resolving mediators are a great choice. They create a micro environment of anti-inflammation in the brain. They've also shown to help heal the attack on matrix metalloproteinases. One of the highest absorbabilities of curcumin. We all know that curcumin is the most active ingredient in turmeric, therefore downregulating NF-kappa B. Continuing with the blood-brain barrier protocol, Magtine, moment on Magtine, that's magnesium L-threonate, has gone through a tremendous amount of studies to really show that how it can populate the brain and increase the magnesium levels of the brain by 50%, for cerebral spinal fluid by 15%, helps with cognition, helps with memory, and slows the aging process of the brain by 9 to 14 years. Omega EPA, DHA pure, omega-3 fatty acids are a great choice. Resveratrol pros, also excellent for the brain. MCT oil will give quick, immediate energy to a slowing brain. So I know there's a question. We'll get right to it and probably close with that question or questions. So if you can prevent the damage to the gut, where 80% of immune cells are lodged, you probably may be able to avoid mucosal immune abnormalities, imbalanced gut flora, intestinal barrier dysfunction, systemic inflammation, neuroinflammation, neuroinvasion, and neurodegeneration. You want to prevent this. The same holds true. If you can prevent leaky gut, you may be able to prevent joint issues and spinal issues. So as Sir Oliver Wendell Holmes once said, the mind once stretched by a new idea never returns to its original dimensions. So if anybody wants to contact me or follow me, there's my social media. We're always doing things on social, videos, hands-on, looking at new articles. We do a lot of stuff with Rob in the UK Nutridyne. As a matter of fact, I think I'll say it now. It looks like I'm coming the second weekend in September. This will be news to Rob. I think a Saturday in Heathrow and a Sunday in Manchester. So hopefully we'll be able to all get together there. You can join my Facebook group. And I see a question.
Hi Rob, I'll read the question out. What do you suggest when melatonin gives bad nightmares, or when, on the other side, keeps the client awake?
You know, I haven't had bad results with melatonin. Obviously, some other people have. I would just take away the melatonin and go down the route of L-theanine, GABA, and as such, and just change the formulation. I do believe that you have a sleep formula that doesn't have melatonin. Am I correct?
Yeah, so we've recently, or just about to, in the UK and Europe, changed the name of Muscle Ease Advanced because we can't call it that anyway. But we are changing it to Sweet Dreams because it contains things like lemon balm, valerian, magnesium, really calming, and you know, things that will help induce a kind of more tranquility, really, in order to, you know, help sleep. So that should be done pretty, you know, imminently, really.
Terrific. You you're doing a great job. Hopefully we'll be able to catch up at the beginning of September.
That would be good, yeah.
I don't, that's the suspected dates, but I'll get you a flyer. You can send it out to everybody, and
Cool.
obviously we can have our kumbaya.
Cool. A couple of points just on your post antibiotic treatment with the Saccharomyces boulardii. The high strength probiotic we do is the ultrabiotic extra strength, which contains 60 billion per capsule colony forming units. So that would be the one to go for. And another note on Magtine, currently we're not allowed to stock it because of regulations. It's not allowed. However, the talk is, or the chatter is, that it should be approved in the autumn. So that's really exciting news for everyone, that hopefully we will be allowed to stock Magtine again this year, later on this year.
Fabulous. That's a breakthrough formula.
Yeah. A couple of other questions, if quickly, Rob.
Yeah.
So testing for leaky gut, I quite often get asked this. You know, how would you go about testing in lab tests that you would recommend?
Yeah, right now I am chief clinical consultant for KBMO Diagnostics. So I think, Rob, if we may, why don't we follow up with a webinar on that, food sensitivity's effect on the gut, so they know how to test for it, and there'll be some different protocols to share. So, something to consider for maybe like September.
Cool. And finally, another one I get asked quite often is the seminar program. How long should each stage last for, or when do you move on to the next one, and etc.?
Yeah, so it's the number one asked question about the program. The program is fluid without question. The answer is not definitive, only because do we have dysbiosis, do we have tight junction, and do we have autoimmunity? So dysbiosis is a 3-month period. So then I would break up those stages into a 3-month period. If it's the tight junction, and I know people aren't going to want to hear this, and zonulin is expressed with damage to occludin, it can take up to 9 months, and autoimmunity can take up to 1 to 2 years. So each one of those will have different time elements. Yeah. So I do have a 1-month gut protocol that you can give everybody and just keep them on, and I think you have that. I think maybe you share that in a post webinar email.
Yeah, well, we'll send the notes out. We'll send the information on the dynamic GI defend as well as that.
Terrific.
So that's all from me. Anything else you want to add, Rob?
No, anybody wants to reach me, reach out. We're going to have some follow-up with Rob. I'd assume it'll be in the fall because the summer people are going to be on holiday.
Yeah, well, thanks ever so much for your time again today, Rob. Thank you for everyone for listening. And yeah, have a great day. See you all soon.
Ciao.